Welcome back to Aonenewstv. I am Megha Verma. Let's have a look on a special story.
National Thalassemia Welfare Society celebrated World Thalassemia Day on 8th of May 2023 at Constitution Club, New Delhi. National Thalassemia Welfare Society and Pediatric Hematology and Oncology Chapters PHO of Indian Academy of Pediatric IAP released evidence-based guidelines for diagnosis and management of thalassemia. The guidelines were raised by Dr. Rajiv Bahal, Secretary to Government of India, Department of Health Research and Director General, Indian Council of Medical Research. Dr. Jagdish Chandra welcomed the dignitaries and said, "We expect a lot from Dr. Rajiv Bahal for child health programs, as he himself is a pediatrician." Dr. Rajiv Bahal, DG ICMR, said, "Though the sickle cell disease SCD has got more importance in recent times, but thalassemia is equally important. I believe thalassemia will also get equal importance like SCD." He said, "All institutes of national importance and medical colleges should have stem cell transplant centers. Thalassemia is a significant health problem in India with 4% carrier rate. It is expected that around 10,000 to 12,000 new thalassemia children are born every year, and around 150,000 thalassemia patients are dependent on regular blood transfusions for survival. Thalassemia can be prevented by the creating awareness in public, followed by carrier screening and parental diagnosis, prenatal diagnosis if required. Life of a thalassemia measure depends upon lifelong repeated blood transfusions, iron chelating agents, drug to remove extra iron from the body, and regular monitoring. Presently, source of scientific information depends upon International Thalassemia International Federation, that is TIF, guidelines, National NHM guidelines on prevention and control of hemoglobinopathies in India 2016. Situations in India are different from Western countries. So many recommendations of TIF cannot be implemented in our country. NHM guidelines are very brief and do not cover many aspects of management. So there was need to have an exhaustive guideline for management of thalassemia, which can be practiced all over India with confidence. Dr. Mamta Manglani, Chairperson, Dr. Neeta Radhakrishnan, Co-Chair, and Dr. Jagdish Chandra, Chair, Hemoglobinopathies subgroup of INPHOG, took lead under the aegis of PHO chapter of IAP to formulate the guidelines. Dr. Mamta Manglani said, "We have come out with clear guidelines for thalassemia for primary care, early referral for managing complications, comprehensive care, long-term monitoring, as well as preventive care." She added that there is no national policy and no registry of thalassemia, and urged that DG ICMR to roll out national registry as early as possible so that every newborn with thalassemia or already under care is registered. Dr. Upendra Kinjwadekar, President IAP, said, "If all government and private doctors follow these guidelines, it will be a complete game changer." Dr. Amita Trehan, Chairperson of PHO IAP, said, "It's unfortunate that there is enough heterogeneity in healthcare in our country, and optical care is not accessible to all. That results into huge burden on families and the system." Dr. J.S. Arora, General Secretary of National Thalassemia Welfare Society, said, "Because of lack of a uniform protocol to treat thalassemia patients, many patients land up into complications. We hope these evidence-based guidelines will help the practitioners of thalassemia to provide best possible care to thalassemia patients all over India." Dr. Neeta announced that IAP along with PHO chapter has created a poster on thalassemia to be displayed at all pediatric and obs-gynae clinics. The poster was released by IAP President Dr. Kinjwadekar. The poster asked obstetricians to add HbA2 report in all antenatal cards and pediatricians to add HbA2 report and vaccination health cards. While thanking the Honorable Prime Minister of India for launching a mission to eliminate sickle cell anemia by 2047. Dr. Arora said on this International Thalassemia Day, I would like to request the Honorable Prime Minister to integrate a thalassemia eradication program along with sickle cell anemia elimination mission 2047. He added, prevention strategy of a sickle cell disease and beta thalassemia are similar in many parts of India, they coexist. Identifying thalassemia along with SCA can be done without adding much burden on cost or human resources. This can be initiated in at least in 17 states targeted for sickle cell anemia elimination mission by 2047. After polio eradication, this is the biggest project of GOI to eliminate SCD from the country. Thalassemia should not be left behind in this mission.
Dr. Upendra Kinzavadekar, I'm the President of Indian Academy of Pediatrics, which is the largest representative organization of pediatricians of more than 41,000 members across the country. So we are very happy to release this. More than 10 to 15,000 babies with thalassemia major take birth in the country every day, and we have more than 100,000 patients in the country. So we need to have comprehensive guidelines. So there were no such guidelines which were geographically specific for India. So I'm very happy that 62 of our members who have worked for more than 18 months have published these guidelines. This is extremely important to know. First of all, let us understand that thalassemia is totally preventable. If we do antenatal screening, if all our adolescents know about their thalassemia carrier status, it is completely preventable. So my urge to all adolescents and the young adults to know your thalassemia carrier status before starting your family. That is utmost importance. And then next important thing is those thalassemic patients, the need, the chelating agents, taking care of their complications. All these facets are important. The psychological care, the emotional well-being, economic part of it, all this is very important. But let's understand thalassemia is totally preventable. All of us need to work for it, and these guidelines are going to go a long way. So all our members are going to put this poster, as you can see, International Thalassemia Day, and this poster would be displayed by all the pediatricians as well as my Foxy colleagues, that is the gynecologists and obstetricians. So the patient should be aware that before the pregnancy begins, they should be aware. If not, they can do the screening test even in early part of the pregnancy and ensure that the child taking birth does not have thalassemia. So let's work together. Please understand that thalassemia is totally preventable. Let's work together.
के संबंध में सब लोग जाने और इसके लिए पूरी सोसाइटी जिम्मेदार है. राष्ट्रीय स्तर पर नीति बननी चाहिए. धन्यवाद.
मैं डॉक्टर जी.एस. अरोड़ा, जनरल सेक्रेटरी नेशनल थैलेसीमिया वेलफेयर सोसाइटी एवं फेडरेशन ऑफ इंडियन थैलेसेमिक्स. आज वर्ल्ड थैलेसीमिया डे है, तो इसके ऊपर हम कोई ना कोई ऐसी एक्टिविटी करते हैं जिससे कि एक तो पब्लिक में अवेयरनेस होनी चाहिए और दूसरा जो है सरकार को इस बारे में सेंसिटाइज़ किया जाता है कि हमारे बच्चों में क्या क्या प्रॉब्लम्स हैं उसको सॉल्व किया जाए. तो आज की जो मीटिंग है वो मुख्य रूप से वो हम क्या कर रहे हैं कि जो इन बच्चों को ट्रीटमेंट है, क्योंकि एक बहुत कॉम्प्लिकेटेड है, उनको जीवन भर ब्लड चढ़ाना पड़ता है. उसके बाद ब्लड चढ़ाने के साथ आयरन बढ़ जाता है, आयरन की दवाई देनी पड़ती हैं और सबसे इम्पॉर्टेंट है मॉनिटरिंग बहुत ज़रूरी है. लेकिन देखा ये क्या है कि बड़े शहरों को या मेट्रोपॉलिटन्स को छोड़ के अगर हम दिल्ली, बॉम्बे, बेंगलोर बड़ी जगह छोड़ दें तो बहुत सी जगह पर उनको सही इलाज नहीं मिल पाता. तो उसके लिए उनको हम सही ट्रीटमेंट नहीं मिल पाता, क्योंकि जो है कि वहाँ के जो बहुत से डॉक्टर्स हैं उनको ही नहीं मालूम कि क्या देना है. तो आईएपी और पीएचओ जो है, उन आईएपी के पीएचओ चैप्टर है, उसने एक गाइडलाइंस तैयार करी हैं जो कि थैलेसीमिया मैनेजमेंट के ऊपर है. अभी तक जो हम गाइडलाइंस यूज़ करते थे वो थे इंटरनेशनल वाली. तो इंटरनेशनल गाइडलाइंस इंडिया में यूज़ नहीं हो सकी. इलाज होगा, उनकी ग्रोथ अच्छी होगी, उनको भी आपके जो फीचर्स हैं वो नॉर्मल रहेंगे, हार्ट पे, लिवर पे असर नहीं होगा और वो भी अपनी ज़िंदगी सही तरीके से जी पाएंगे और जैसे कि एक सामान्य व्यक्ति जीता है. तीसरी चीज़ मैं कहना चाहूँगा कि ये जो बीमारी है ये जो है क्योंकि अनुवांशिक है, यानी कि माता पिता से बच्चों में आती है.
That's all for now. Thank you for watching Aonenewstv. If you like this video, then share it and subscribe this channel. Thank you.